And the Texas measles outbreak is spreading quickly. State health officials now report more than 400 cases, growing by 22 new cases since Thursday. Children and teenagers make up the majority of those infected, and almost all of those cases are in those who are unvaccinated. Let's get right to ABC News medical contributor Dr. Alok Patel for more on that. Dr. Patel, Texas health officials say at least 4 people who are fully vaccinated also got the measles here. So why are we seeing some breakthrough cases?
Well, Diane, the measles vaccine, like any other vaccine, is not 100% effective. It's 97% effective, which is still phenomenal. But with that being said, if 100 people who were protected all got exposed to measles, statistically, 3 might get breakthrough cases. But what's important to note is that those 3 individuals are much less likely to become severely ill. It's like wearing a seatbelt or a helmet. You can still get injured, but it's much less likely to be serious, which is why vaccines are so incredibly protective, even if you do get one of those rare breakthrough cases.
What about herd immunity? How does that relate to how measles are spreading?
Well, measles is so contagious that herd immunity, the percentage of vaccination we want to see in a community to prevent that person-to-person spread, is about 95%. And in some places, like Gaines County in Texas, that number is 82%, which leaves pockets of people very vulnerable to getting measles and having it jump from person to person. It reminds me of playing with magnet tiles or Jenga tiles. For example, when you start removing little pieces of protective herd immunity, the entire thing can topple and you can get an outbreak.
And I just want to break it down even further than that. When you say herd immunity, you mean enough other people are protected from getting or spreading this virus that the very small percentage of people who can't, like young children who are too young to get the vaccine, for example, are still protected in theory because the whole group is protected. Is that the idea?
That was a phenomenal scientific teachback, Diane. That's exactly right. Because there are plenty of people out there who are not protected, such as young children or people who can't get a vaccine. And so by having 95% of the community vaccinated, you are essentially protecting the entire community, including those who are most vulnerable.
And for people who are unvaccinated, they are at higher risk. But what if you've only received 1 dose of the vaccine? Again, if you have young children under 4, for example, they probably have only had 1 dose.
It's a little bit of a gray zone, but even 1 dose of the measles vaccine is about 90 to 93% effective. So even getting that first dose when your kids are young is still an extremely important step forward. The second dose will boost that number up to 97% and confer that lifelong immunity.
There's also a blood test you can get that measures the level of antibodies in your system. What does that tell you?
I'm getting a lot of questions about these blood tests. So essentially what a blood test can do is look for antibodies to tell you if you have some immunity against the measles, either because you were previously exposed or because you were previously vaccinated. That's an important step if you're unsure about your status, which is why it's also important if you don't know if you've been vaccinated against the measles in the past and you're exposed, to call a healthcare professional to get some guidance on next steps.
All right, Dr. Alok Patel, thank you. And if you have questions for Dr. Patel, leave him a message on our Instagram feed. He might answer your question right here on Friday.